is
5 Action News, and I am Ethan Lavarnway. In today's special report, we will be exploring the subject of prostate cancer. Prostate cancer has been on the rise in recent years, and it affects many men in America. We go now to Norton for more info.
Yes, Ethan. The National Cancer Institute says that about 2,250,000 American men that are alive today have been affected by prostate cancer. This is over 1.5% of all men in America. That may sound a bit scary, but there is good news. If the cancer is caught while in the localized regional stages, there is 90 to 100% chance of survival. This is the reason that prostate exams are so important, because if the cancer isn't caught before it has a chance to metastasize, the survival rate drops to just over 30%. We sat with Ryan Witt, a student at the Boonshaw School of Medicine, to tell us more about the subject.
What is prostate cancer?
All right, well, we can talk about what the prostate is. The prostate basically is a male glandular organ that's located near the urethra, a little bit above the urethra. And what the prostate does is it makes secretions that are part of semen. And what prostate cancer is, it's an abnormal overgrowth of this glandular tissue. And as I said, it's uncontrolled growth, similar to other cancers.
What are the risk factors of getting prostate cancer?
Well, the number one risk factor for getting prostate cancer is age. As men get older in age, they're more likely to have prostate cancer. Another known risk factor is race. African American men are more likely to get prostate cancer, more likely to get it at a younger age than Caucasian or even Asian men. A modifiable risk factor known is diet. Diets high in fats and saturated fats are a known cause of prostate cancer. The connection isn't as clear as let's say like smoking and lung cancer, but it is known. And another risk factor is family history. If someone in your family has a lot of men in your family have prostate cancer, there's more likelihood that you could be susceptible to prostate cancer as well. So most of the risk factors you can't really control other than the diet, and that's one of the things that makes prostate cancer a little bit different than some of the other cancers we know about.
How does a person avoid getting prostate cancer?
There is no real good way to avoid prostate cancer. The best thing to do is to just be aware of prostate cancer as we age, and possible risk factors as family history and others. As we mentioned, age and race, and to talk to your doctor about it. And
Okay. So, what is a prostate exam? In other words, what happens during a prostate exam?
Okay. Many men really fear the prostate exam. A lot of people talk about it, and there's a lot of misconceptions. The formal name for it is known as a digital rectal exam, and it is, as it sounds, the doctor will use one of his digits, insert into the rectum, and you can palpate the prostate from the backside that way. It is slightly uncomfortable. It's not nearly as bad as people make it out to seem. It takes about five seconds or so, and so I mean that's really the best way to check the prostate. And what they're looking for is hard nodular lesions on the prostate that represent cancer. There's also a condition known as BPH, which is basically an enlarged prostate, and that can also cause urinary symptoms, and it's also a way to check for that disease as well.
So, how often should a man get a prostate exam?
Okay, if a man is having any of the urinary symptoms, as we mentioned earlier, such as increased frequency, painful urination, any kind of blood in the urine, dribbling, change in stream, then a prostate exam is indicated to assess for a prostatic cause of those urinary symptoms. If this is again where the controversy comes in. When should a man start just getting them on a normal basis if he's asymptomatic, having no issues? Some of the current thinking is between the ages of 40 and 50 to start having this conversation with your doctor. African American males around between 40 and 45 can start getting those prostate exams as part of a prostate screening process, and then Caucasian men, usually 45 to 50 is the age range where this starts to become an important part of an annual physical exam.
What is the chance of surviving prostate cancer if it is found while undergoing a prostate exam?
Well, surviving the prostate cancer, that all depends on how advanced the prostate cancer is when it's discovered. If it's caught earlier in the disease and it's confined to the prostate, surgical treatment can usually eradicate the cancer. A lot of times it's not caught until it's already pretty far along, and in those cases, if it's already metastasized, then the chances of survival are a lot less. Luckily, prostate cancer is a more slow-growing cancer compared to some of the others. So even in older patients, if it's caught, the patients are more likely to die of something else within 10 or 15 years. Usually, treatment's not even undergone. So I mean, there's a lot of factors that go into the mortality and morbidity associated with prostate cancer. Like I said, how far along the disease is, if it's metastasized, and just the general health of the patient and their age. So.
How does prostate cancer metastasize?
Okay, similarly to other cancers, cancers can metastasize basically in three ways. The first is through the bloodstream. If it invades enough to reach into like a capillary or artery, vein, something like that, it can metastasize that way and seed elsewhere in the body. Through the lymphatic system as well. As you may know, in breast cancers, they feel for lymph nodes in the armpits. In prostate cancer, you can feel in the groin lymph nodes, but it's usually not. Enlarged lymph nodes aren't typically associated with prostate cancer. It's not where they go, but the lymph system is another way it can metastasize. And the third is just if it grows enough, it can outgrow the prostate and invade into other tissues directly. As I said, low back pain is associated with prostate cancer sometimes, and that's just because it directly invades into that area.
Is prostate cancer on the rise or on the decline?
Well, as I said earlier, as we keep people alive for longer and longer, if men are reaching their 80s, 90s, 100s, they're more likely to have prostate cancer. As we mentioned, age is the #1 risk factor in prostate cancer. So in a way, as we keep people alive longer, there's more prostate cancer. So in a way, it's on the rise. That way, also, as more and more awareness of prostate cancer and as testing for prostate cancer advances, more and more are being picked up by physicians, and in that way, the numbers look like it's rising as well. But it's not a direct correlation to an environmental factor or something else that's causing more and more prostate cancer. It's just the fact that men are living longer and that screening techniques are becoming more sophisticated.
Options are available for people with prostate cancer?
There's three main treatment options that are typically undergone with prostate cancer. The first is surgery. Excuse me. Going in and surgically removing the prostate. It's usually for a localized disease that's just confined within the prostate. There's also radiation therapy as well, and they even have a newer type of radiation therapy where they can put basically little seeds into the prostate of radiation, and then it can eradicate it that way. The third is a hormonal therapy. The prostate as a organ is typically responsive to testosterone in the body. So you can use hormonal therapy to reduce the body's testosterone levels, and that can sometimes help shrink the tumors a little bit. Typically, that's for advanced disease, and you're not necessarily curing the prostate cancer, but you're just trying to make it a little bit better so the patient can live a more symptom-free lifestyle.
have a good night. And that is it for us today. I'm Ethan Lavarnway. Thanks again for watching. We'll leave you with some more interesting prostate cancer statistics. Take it away.